Assalamu alaikum. Good evening, everyone. My name is Habiba Kande, founder of the Eritology Institute. I'm pleased to say we have another special guest, a distinguished guest, a repeat guest, Dr. Shannon Chavez, who is a licensed psychologist, a certified sex therapist, and a clinical sexologist. And she is going to be talking about rebuilding confidence and intimacy as well as consent, coercive control in light of the Diddy trial, as well as how to heal from past experience in relation to trauma and things like that. So, Dr. Shannon Chavez, Assalamu alaikum. Good evening. Oh, good morning. Sorry.
Wow,
How
alaikum
are you?
assalam. Good to be here with you again.
The pleasure's all mine. The pleasure's all mine. Again, before we start, I know I've done this a previous before, but do you mind giving a quick high-level introduction in terms of who you are and the work that you do?
Yes, I like to think of myself as a sexual health and wellness expert. I work as a psychologist out here in California, offering therapy, working with couples, adults, individuals dealing with all sorts of sexual concerns, relationships with their partners, spouses, dealing with trauma. And my approach is a holistic approach. I want to teach people about sexuality. I want to help build confidence around sex and intimacy, and also help people feel empowered and break through the barriers that many of us have around sex, intimacy, and pleasure.
Lovely. And Dr. Shannon, for those who may not be familiar, she is a sought after expert. She's been featured in, I was looking at her website. I mean, there's so many publications from GQ, BuzzFeed, New York Times. The list goes on and on, Cosmopolitan. So we're very grateful and pleased that we have an expert in our midst. And she'll be educating us. And also I believe that we have some people who are attending who are religious leaders and community leaders and aspiring therapists. So Dr. Shannon Sharpett is definitely someone I would highly recommend for anyone who wants to learn more, and obviously for counselling. And we'll be speaking a bit more about some of the services that she offers, because she does have experience in both faith-based communities, people that come from conservative backgrounds, and she also provides sex therapy and intimacy coaching, which we'll talk about a little bit later. But before we get into that, obviously, in light of recent events, there's been the famous trial of Puff Daddy P. Diddy, the sex trafficking prostitution trial. And I've received a number of questions from people asking, like, what is consent? What is coercive control? Obviously, given that you're a specialist, a psychologist, can you help explain or help us understand what is consent?
Yes, consent is such an important conversation. It's really the root and foundation of not only sexuality, but intimacy, understanding people's values. Consent, I would say, is a mutual agreement between all parties involved in any activity. It could be sexual, it could be physical activities, any social connection. And that agreement is about what's going to be happening in that situation or scenario. So, for example, in sexual consent, it would involve an understanding of what's going to happen in that event of activity or connection. And I like to remember this acronym for consent around sex called FRIES, which means that it's freely given, it's revocable and also reversible. It's informed, which means we know what we're saying yes to. Also, that there is excitability. That doesn't mean we're jumping up and down saying yes, excited, but that we're genuinely interested and it's something that we desire, as well as it's specific. It's not something that feels broad or vague, and we aren't understanding exactly what that is that we are engaging in. So, consent is also not just one conversation, it's an ongoing and evolving communication between all consenting adults.
Not very well said. I love that. I love the FRIES acronym. I'm going to try and remember that. And you said that it's a mutual agreement. So is it something that has to be, forgive me if this sounds like a stupid question. Does this have to be down in writing? Does it have to be verbalized? How is this agreement made? Could it be non-verbal? Could it be without writing it down?
That's actually a great question. So, some people like to have an actual written agreement. That way, it's clearly stated in their words what it is that they're saying yes to or agreeing to for that type of play or activity. For many, it's a verbal agreement, or it starts out as conversations before play, during play, and even after any play or activity. So, it can happen in many forms. I think what we don't want to do is assume consent. for example, there was a nod or body language, or you sort of said, sure, yes, we want to make sure that it's very clear. Clear communication means that there's mutual understanding. We check in with the person. Does this mean you're comfortable with this? Does this still feel okay for you? So it's something that we can feel open to continue asking and checking in around. And I would also say the language is important. We want to make sure we are clear on how we are being informed around what we're giving consent to, and also what we're hearing back, that we can repeat that back and say, is this a clear yes from you? Does this feel okay?
hmm hmm And you mentioned that consent can be revoked. So does that mean if, for example, a couple's, I mean, they've agreed that they're going to engage in sexual activity, and then during the encounter, one of the partners, for whatever reason, I mean, are they allowed to revoke that consent? And if so, how would the other person know?
Exactly. That's a really good point. And it's a touchy subject because there's a lot of misunderstanding around that. But yes, that means that we're continually checking in. And if we want to pay attention and be present during our sexual encounters. So if someone is starting out with an enthusiastic yes and something changes and shifts, that's normal to happen. Things come up, we get triggered and overwhelmed, or emotions can arise. So we want to pay attention to what we're noticing and not assume anything. I always say, if it hasn't been spoken, it doesn't exist. Be clear on what you're noticing, be curious. It is, if we think about it, sex and intimacy is a partnership connection, it's about relationships. So checking in should be something that we normalize, and don't assume anything that might make someone feel unsafe or uncomfortable in that situation. And if the consent is being revoked from the other partner and you're the one hearing that, make sure that that makes sense and understanding. What is it that you're feeling uncomfortable with? It could be maybe certain parts or elements, or maybe needing to take a pause or a break to check in with one another and talk about what's going on. It's important that we have a process for consent that doesn't feel overwhelming, or it's healthy vulnerability.
Mhm. And has attitudes changed towards consent since you've started, doing your work? I'm just wondering over the last, because there's a lot of conversation I've noticed around consent the last like 5 to 10 years. I'm wondering how attitudes were towards consent maybe, I don't know, 15, 20 years ago.
I think there's a lot of fear around consent, of not being prepared for those moments like we just discussed, right? If there's a misunderstanding, or if we don't know how to communicate or give that feedback. And I think the conversations are changing a lot as well, because we're seeing more media coverage and topics about violations of consent and how important it is to understand consent on all levels, even outside of sexual intimacy. Consent can be important in the workplace, any big decision that we're making in our life. So it's definitely broadening our conversation around consent, but also people are wanting skills. I want to be able to be clear on what consent is. I want the communication skills. I want to know how to navigate those uncomfortable moments if something were to come up.
And what age would you advise someone to learn about consent? Is it just before they get into relationship? Is it when they're a child? When should people understand what is consent?
I would say as early as possible. I mean, if we're thinking about childhood, we're talking a lot about consent with children now around touch and what's appropriate and comfortable for a child, even if they're receiving a hug or praise or any communication that may feel uncomfortable. So I think there's consent that should be discussed at every stage of our life. Obviously, when we get into intimate relationships, there are whole new layers of consent to talk about when we navigate intimacy and sex and relationships and boundaries. So obviously, I would say consent conversations based on where that person is in their development and what types of situations they're going to encounter in their social life.
And this brings me to another term that I was recently made aware of. Consensual non-consent, CNC, that's popped up over the last
Yes.
year or so. Well, in terms of in my radar, can you help explain what that is?
Yes, I would say consensual non-consent, or CNC, is a type of erotic play where there can actually be role play, around non-consensual situations, but done safely and contained in an environment where there is communication beforehand and negotiation and agreements beforehand, even safe words and aftercare. For some people, this is kind of edgy. They may say, why would anyone want to role play a non consensual situation? For many, it can be erotically thrilling to have a psychological experience where something that might feel risky or kind of edgy in that particular way be in a contained and healing dynamic with another person that you trust, and that you can have even a corrective or healing experience from something that may have been traumatic before. So it's more popular, prevalent in more of the kink community, but I see even a lot of conventional couples now playing with this dynamic in order to build trust and openness around dynamics of play and communication, where there has to be this relational mutual understanding. So I think sometimes I think the kink community can demonstrate healthy sexuality better than any other community because of the process that they go through. Discussion, communication before anything is ever initiated, making sure that everyone is feeling safe and comfortable, having ways to navigate that play scenario so that everyone can continue giving consent throughout that experience. So it can sometimes be a good model for how some people can heal or work through trust issues, betrayal, or traumas that have shown up around sex and intimacy.
Right. I mean, I found that people in the kink or BDSM community are more, apart from obviously professionals like yourself, there's a lot of information about what is consent because
Mhm.
of some of the behaviors, like you said, might be risky. So it's very clear in terms of explaining what are the boundaries. Whereas I've noticed that people that maybe are in more conventional, traditional relationships where a lot of things are assumed, like whether someone's in a relationship or marriage, it's just assumed that consent is given. So I do find that a number of people that I've come across in the kink community are more kind of educated or more progressive in terms of pushing a conversation about consent or people understanding what it is. Whereas I've noticed that people, like I said, from more traditional, conventional relationships, they just assume that, and that also can obviously lead to a lot of issues. I don't know if you've come across or experienced something similar.
I actually agree with that quite a bit. If you look at some of the kink communities, there's a lot of education before you're even allowed into a play space. There are certain requirements that you have to go to, even a 101 on boundaries, what types of communication are important, how to negotiate and compromise scenes. And I feel like that's a nice foundation. If we think about it, how many people out there are lacking any sex education at all, any intimacy skills of how to navigate through any of that. So I think that there being standards and foundational components that people have to engage in before playing is something that we should think about. There should be certain standards of responsibility before you're able to go out and explore all of the sort of nuances and edges of sexuality. So it could be something that we should apply to wider populations.
Yeah. And I know you do a lot of work with faith-based communities and people from conservative backgrounds. Are you finding or do you find similar challenges in terms of for people to understand what is consent? Because I find that a lot of people from those backgrounds, it's assumed like when you get married, it's assumed that the man has access to his wife whenever he likes, which I don't necessarily subscribe to. But I'm just wondering in terms of how do you are you finding challenges with communities, especially faith-based and cons- conservative-based communities, in terms of understanding what is consent, and if so, how are you bridging that gap?
I do see that quite a bit in conservative communities. I think a lot of it is lack of information and sort of awareness around your own values. Often that's one of the first questions I ask my clients. What are your values and beliefs around sex? And there's a lot of confusion around that. There's beliefs that have been taught or learned and reinforced, but often when it comes to that individual's own autonomy of how to take care of their body, what feels comfortable, they feel very lost. And so my approach is sort of helping them develop that sense of awareness. Let's figure out what that is. Let's find a sense of making you feel comfortable and confident and empowered around what you want to experience in terms of sex. And if it's in couples dynamics, making sure that nothing is assumed. Whether couples are aligned in those beliefs or not, they still have to develop that intimacy in their relationship. So they still have to talk about it, even if they assume they're coming from the same mindset of, what's required of us or our duty or what we want to experience or what our roles are as husband and wife. It still has to be communicated. So I still feel like that foundational piece is necessary. And it's skill building. It's all about skill building and fine tuning and being comfortable, practicing. We do a lot of that in sex therapy. We are role playing that communication. Let's talk about how to do it in a way that's effective. Let's talk about why maybe this way wouldn't be so effective. I think that practice and learning is so important. And many couples are not prepared for that. They go into marriage and they are just completely in the dark around what to do. And that's where I meet a lot of young couples, especially from conservative backgrounds. We have no idea what to do. We're almost creating a trauma dynamic in our relationship because we don't know how to navigate these dynamics.
And 'cause I did see on your website, and I think you did mention previously about some of the work that you do with pre-marital counseling. Is that also some of the like helping people understand their values? That's a really good question about what is your values and belief systems and getting information out, but in terms of understanding consent, is that also part of what you would facilitate when you're having the premarital counseling sessions?
Absolutely. I'm asking a lot of questions. We're doing a lot of surveys and assessment questions because if you think about it, we get a lot of information, even when coming from more conservative communities, seeing things in the media, hearing things in our social environment, and that starts to interfere with our own understanding of who we are and even our purpose or drive towards connection. So it's a complicated relationship with pleasure. We want to piece that out and give people a space to talk about it in a non-judgmental way. My job as a therapist is not to develop your beliefs or inform your values. It's to help you navigate. I'm kind of helping drive that through giving you a space to put it all out without shame. There's so much shame and awkwardness and embarrassment around how people feel sex should be or what they want to experience intimately that's what we're really working on. We have to have safety, and that's missing so much from conversations around pleasure and connection, even in married coupleship.
Mhm. So you spoke about your work as a therapist. Do you mind, because I know you also work as an intimacy coach. Can you explain the difference between the two? What is a therapist or sex therapist, sorry, and what is an intimacy coach in terms of the work that each role entails?
Yes, I did mention coaching, and coaching is such a big part of my work. I love all modalities because I think people think of therapy, and this came from my culture as well. Therapy was sort of a taboo thing. We don't go to therapy. That's, for other cultures. And therapy to me is a place to examine and look at your past and how it influences the present. It's looking at how you were raised. What were the things that you learned in your environment? How were you loved? And how does that develop working models of how you experience relationships and social engagement? So it's really looking at your development and how that has shaped who you are as a person now. Coaching's a little bit different. It's, I would say, the more solution focused, resources based. For a lot of people, they may come in with a question or something that they need some help or good references around. And we're not looking at the past as much. We're looking at current behavior. What can we do to help address a more specific issue? We might not talk about upbringing or family of origin. It's very specific, and it can be suggestions. Sometimes coaching can be 1 or 2 sessions where I'm teaching a client about their anatomy or techniques or skills that help them build confidence. In actuality, my favorite modality is a mixture of both. I think that therapy and coaching go well together, and at the root of both of them is education. And that's what I feel most of my adult clients are needing more than anything. We need to learn. We were never taught this. Why did no one teach me about my body or how these things work or how to communicate with a partner? Education is also something I do. I do a lot of speaking and teaching for big groups and workshops and retreats. Any way I can get people talking about sex and sexuality, I feel is healing. So all modalities work well, really depending on what you're looking for and what the concern is.
Right. So you mentioned education, adult education. So again, forgive me if this is a stupid question. So is it correct in that sex education doesn't stop when you are an adolescent? Because there's an assumption, especially in the UK, that sex education is really for youth, like children up until when one's kind of sexually active, and then after that, one knows everything that there is to know about sex ed. Is that the case?
I wish that were true, but that is not. I'm smiling because I love that it's something we continue learning. Even as a sex therapist and coach, I'm constantly learning about sexuality. It's something that we'll continue doing our entire life. In fact, we start learning about sex immediately in our life as we're learning how to experience connection. So I think it's something that we should embrace throughout every aspect of our life. In fact, working with more conservative populations made me develop a non-pornographic sex education program for adults. Because I think people think of sex education as just the performative or functioning part of sex, but the majority of it is the intimacy skills, learning how to talk about what we want and desire, what feels good for us, being empowered around our sexuality. So it's something we should embrace. I mean, it's fun to learn about sex. I think people feel, I should know everything. And what does it mean about me if I don't? It's not embarrassing to not know everything. In fact, we should embrace it. It actually helps us heal our shame and not internalize our shame the more we learn about the diversity that exists under this big umbrella of sexuality.
Mm-hmm. Agreed. And now moving on to a slightly more difficult topic, one about obviously coercive control. And can you help us understand what is coercive control and how that might look in a relationship or an encounter?
Yes, this is when an individual may use their power, their privilege, their position to take someone's autonomy. They start controlling every aspect of their life. When we see it in relationships, it can start out slowly and build into these extreme patterns of behavior, controlling what they're doing, how they're socializing, their friends, the way that they dress, financial control, gaslighting, manipulation. It can have extreme consequences in terms of how it impacts that individual who's being controlled. It demolishes their self esteem and self worth. They become dependent on this person by how the coercive person is controlling every aspect of their life. Many of them feel helpless and hopeless getting out of those dynamics. So it can be incredibly dangerous with pretty severe consequences to mental and physical health.
And is coercive control, is it always psychological or can it be, I mean, is it always physical or can it be psychological? Again, the only reason I'm saying that again is just especially in light of, the recent trial. A number of questions that I've been receiving or people asking questions is that how can it be coercive control where I'm just using them as an example. Or how can you have coercive control when with someone that you're in a relationship with? That's not possible. Or the person after showed that they were happy to be in this relationship with this person. So again, I'm just trying to help people understand, of even for myself, if someone has been coerced in their relationship, does it mean that they are always going to be in a place where they feel they have been coerced, or can they then show signs that they're actually happy to be in that relationship?
It happens mainly in intimate relationships. So I think that's often a misunderstanding that this is something that happens outside in these encounters that aren't from intimacy. It usually develops within relationships where it's someone that you know, someone you trust, someone that you've opened up to and committed to in your life. So it may not start out that way. And I think in many cases, even this trial that we're hearing now with Diddy and Cassie Ventura, it starts out as maybe a loving, intimate relationship and starts to slowly build into that. So it can start out with coercive control. Couples can also heal through that. I've seen a lot of couples actually come to therapy and seek support for help around some of these patterns where a partner is willing to change and is aware of some of those patterns of harm that they're doing to a partner. And for others, it can escalate and develop and get out of control. And these patterns can be hard to know how to manage or where to go for support or what to do. And when there's trauma can leave us in a state of freeze and dysregulation where it's hard to access, you know, making good choices and seeking help, or that control has isolated any resource available for you. So yes, it's most common in these relationships, which is why we need to talk about it and help people be aware of how to notice the signs and what to do when you how to help yourself when you're in that situation.
And for someone who has been in that type of relationship, is it something that you'd recommend seeking help from a therapist? Or, and again, forgive me, it sounds like a silly question because this is what I do receive. Or would you say they should just speak to a religious leader, who maybe not be qualified, or a family, a friend? What advice would you give to someone who's been in a, or who is in a relationship where they're experiencing coercive control and trauma?
Well, the advantage of working with a therapist is you're going to have a trauma informed lens. Most therapists have that background and training. And with having that trauma informed, you're going to put language to what's going on. These patterns of behavior, we don't want to just stigmatize or label that this person has this or that. We want to look at what's actually happening in the relationship. These patterns can be, it starts out, I'm walking on eggshells, it's hard to talk or have a voice in the relationship, to absolute control and disempowering the individual. So therapy will really help in addressing and unearthing those patterns. I think for those that feel safe and comfortable going to maybe a religious leader or someone in the community, the advantage of that is at least there's disclosure and someone that can advocate for getting better help or support. I think what's often concerning about people that might not be qualified is, what if I'm not believed? What if what's happening in my relationship is minimized? Or what if I'm told that this is normal? So many people end up feeling silenced or isolated in getting help, or they were told this is nothing, or you need to work harder on your relationship or marriage. And I think that can do a lot of damage, obviously, and create a lot of shame for that individual. So the advantage of having someone specialized in this is they're going to see that and recognize that and help put you on the right path to healing and taking care of yourself, which may mean getting out of this unhealthy, abusive relationship.
Yeah, no, I agree because I have a number of friends who are like religious leaders, like imams or community leaders, and most of them will say that at least 80 to 90% of the queries they receive is in relation to like counseling, relationship issues, marriage issues. It's not about like the actual religious rituals, shall we say. And many of them are now thrust into being pseudo therapists and counselors, and many of them haven't got the adequate training. And one of the challenges again is that sometimes I've noticed people might diagnose things that they've heard, things like addiction, or say that someone is a narcissist without, because they've read something in a book or watched a YouTube film or something or whatever. So that's why, again, it's important that we highlight,
Yes.
like you mentioned, qualified individuals like yourself who can provide the necessary services. And obviously, if there's a diagnosis needs to be had, and you can provide it. I just think that that's something that, like I said, because I see it time and time again where people will who are in positions of authority and power, but not realizing where their boundaries are. So because you might be an expert in the Bible or the Quran, that's very different from being an expert in psychology, or because you might have a degree, that doesn't necessarily mean that you're licensed and qualified to provide services. So that's why I just wanted to. I don't know if you've found that because again, it's just something that I've seen quite a bit, and it can be quite frustrating because then sometimes people not qualified will then say things or maybe normalize abuse and not realize what they're saying, and then obviously the person, like you said, can feel like what they're going through is being minimized. So that's something which again it's definitely a challenge,
Exactly. It's
especially.
so vulnerable to tell anyone what's
Yeah.
going on, especially when there's abuse or things that we don't understand ourselves. So you're opening up and then being told what their perspective is based on their experience, which may be very limited. And to be honest, I see this happen a lot, even with therapists in the field that might not have adequate training, especially as a specialist in sexuality. I'll work with a lot of clients that have been shamed by therapists or been told it was this or your fault or you need to do that or you need to, things that's not our job to advise a client one way or another. We're really helping to build that awareness and helping them make good decisions by educating them and giving them the tools. So I've seen a lot of that happen, even with qualified professionals. So I recommend that people make sure when you are speaking with someone to talk about what their background and training is in this area. How have they worked with cases like yours? What are the outcomes? What is their approach? What are their own values that shape the way that they work? And I take it to heart, this work that I do. It's so personal. So I want to, more than anything, make people feel safe and comfortable to express themselves and not to judge them. There's so much judgment, even by therapists, that I've seen a lot of damage being done. And I want to protect people from that. That shouldn't be your experience, but it happens more often than not.
Yeah. And this is linked to what we spoke about previously about coercive control. And this is, I kind of ripped this off from your, and if anyone is interested, please check out, and I will send a link to Dr. Shannon's website. But there was a really, really good article that I wanted to kind of ask a question about. Why do public figures engage in risky behavior? And can you help us understand the psychological and behavior factors that contribute to such behavior? And could this behavior be classified as an addiction?
This was a hot topic when I first started out in this work. So, sex addiction was a big buzzword in the media. Public figures, I think, like anyone who has a lot of power and privilege, they have accessibility, they have a certain level of invincibility and protection. So they don't have as much accountability as the average person. They have a lot of protection around them and use that power in ways to get away with a lot of this behavior. Also, I think with the more power and less accountability, it changes their relationship to sex and sexual behavior. There may be more power dynamics and control, and it's less about intimacy and more about this sort of self-serving behavior. And I think we see it a lot with politicians, these public figures that are under a lot of scrutiny and also have such a pressure to withhold this public image. And when I work with clients like that, I find that incredible amount of pressure just to help, they're crumbling underneath. A lot of them are seeking, they want, they're almost living these dual lives. They feel like who they really are is something they have to hide. So I see that sometimes showing up quite a bit in these compulsive sexual behaviors. It's not necessarily about sex, but it's about an escape. It's a coping mechanism for these incredibly overwhelming emotions that they're not able to manage on their own. And I think that's my biggest issue with the term sex addiction. People hear that and they think this person is addicted to sex. And if we just treat the addiction, then they won't have the problem anymore. But at the root of that, I see someone in a lot of pain. I see someone who doesn't know how to cope or deal with these overwhelming or underlying layers and emotions. Someone with a trauma history that has never had any treatment or help and is using their position or role to cope or fill voids in their own internal world. And that leads to a lot of shame and secrecy and definitely, more prone to these types of behavior. You'll see a lot of similarities in profiles of people who have compulsive sexual behavior.
Yeah, so the compulsive sexual behavior, is that the same as sex addiction, or is that something different?
It's actually all based on, it's interesting because even in our field, people will say it's not an addiction. This is the way to refer to it. I refer to it as compulsive sexual behavior because I don't necessarily think it's an addiction like we would look at chemical dependency. I see it more as a coping mechanism, a way that people learn to develop protective behaviors or mechanisms or defenses to deal with or not deal with emotions that are happening under the surface. I would say the compulsivity sometimes acts like an anxiety or an obsession. And so we can look at it like we would some of those clusters of behaviors in mental health. And that's how I usually treat it. If we can develop healthy dependency and even a healthier relationship to sex, so it's not something that you're using to manage stress or deal with overwhelm, it shifts the way that you're using that behavior. So it's not necessarily an addiction. And my problem with that industry is that they were sending everyone into this sort of treatment mill model, and it was shaming, it was stigmatizing, it wasn't sex positive, and it was kind of just creating more internalized shame. And I saw a lot of people coming back into treatment after going through a full, sex addiction treatment program. So I think the programs have evolved a lot, but there's still a lot of area for improvement.
And is that the same as porn addiction? Would that be the same in terms of how it's not really an addiction? It's, as you explained, a compulsive sexual behavior. Is that the same as well?
Yes, I mean, I look at phone addiction and sex addiction or porn addiction very similarly, right? Anything that can claim our consciousness can feel like an addiction because we develop a dependency. There's an instant gratification. It's a way that we can kind of deal with or band-aid over these issues going on underneath the surface. And I think porn is tricky for people because they think porn is the problem, right? If we just take away porn, then we won't have compulsive behavior. What we've seen so much in our research and work is that when you take away porn, they will develop another form of dependency very similar to that. So I call them more process behaviors or compulsivities. So things that we're doing to cope with internal problems. And I don't think porn's the issue. I think that that just becomes the source of how that person is using it to escape, to isolate, and to deal with a lot of underlying issues, self-esteem issues, confidence, lack of skills or awareness around sex. And it's not really about pleasure. That's, I think, a big misconception. People think if someone is compulsively using porn, that they are in this state of enjoyment or pleasure or euphoria. That's the very short-lived part of that experience. Much of it is shame and isolation and loneliness. So it's a very stressful and distressful experience for someone dealing with this.
And how? Because I often hear people cite a number of research papers. I don't know how accurate they are about sex or porn addiction in particular, damaging the brain and things like that. How true and accurate are those? Again, I love to often hear that from especially people from a religious perspective, whether from a Christian or Muslim perspective, talking about also like the epidemic of porn addiction and how it destroys or messes up the brain and things like that. And they cite some neuroscientists. Um, are those sources correct and accurate? I'm just wondering.
I'm smiling because they're very sensationalized. I remember this website, Your Brain on Porn, and it had these brain scans, and here's what's happening to your brain. It kind of reminds me of, in the 80s, they had the Your Brain on Drugs and these very, emotional, dramatic commercials. And of course, anything that we're doing can impact our brain functioning. I'm pointing to my phone again. Our phone and social media and scrolling has the same impact. I think when sex addiction first came out, they showed these very prominent brain studies of here's a brain on cocaine and here's a brain on porn, and they look exactly the same. Now, let's be real here in terms of neurology. Obviously, the same areas of our brain are lighting up if we're using something that feels stimulating to us. These are the reward centers of our brain. This is where our dopamine and neurotransmitters that make us feel good are releasing chemicals. So it's hard to prove that, even though I know these sites really have a strong argument with all of this pseudo research and neuro studies, but I think that it's very limiting. And again, it's sort of demonizing porn as the issue. And I think I would clearly argue that phones, media, any sort of stimulation that's similar in that way can have the same impact, if not more.
Hmm. Hmm. And I also saw a study, I think it was last year, but I think the study goes back maybe 5 or 10 years ago that religious people are more likely to self-identify as being a sex addict, even if their patterns or of watching porn, for example, is less than the average person who wouldn't identify as a porn addict. I don't know if you came across that study, but it was quite interesting that they were saying that because, okay, so just say, for example, religious people, whether they're Christian, Muslim, Jewish, or what have you, watching porn is obviously considered as a sin. So any form of watching porn, they would see it as this worse than like what it is in reality. So they'll consider it to be like an addiction. I don't know if you've come across that study, but that was really fascinating. That I was just one that study where they were talking about how people who are inclined to religion are more likely to see certain behavior patterns to be, from a clinical perspective, much worse than what they actually are. And that's why I was always interested in like, why is it now there's a lot of, campaign around like the sensationalized headlines like you mentioned, or blaming porn or porn addiction when you actually look at the experts, they're not actually always saying that. That's why I'm just wondering where does that disconnect come from? And especially some people might have religious training, but they've taken a course or two on psychology, will then become like a porn addiction expert or sex addiction expert. And I
Yes.
just find it quite problematic because it's like that's not actually what the research actually says or what the experts saying, but some people will cite a couple of pseudo research papers or what have you, and then that's kind of seen as this is what the experts say. Sorry, I went off on a tangent, but
No, that's a good
sorry.
tangent. I hear that often, even from therapists. I'll have clients come in and say, my primary therapist said I'm a sex addict. And we'll have to kind of unpack that. What does that actually mean? I often find that that's the person's discomfort in addressing sexuality. I look at it from a lens of if someone is saying they're, using porn and it feels out of control and they're really wanting to address this, what's going on? Why am I doing this? We want to look at why. What's the underlying driver of that behavior? But I think because it's porn and it's something that we don't want to talk about and it's dirty, it's wrong, it's bad, that we just sort of label it and sort of push people along to, figure out what this is or just stop using it, abstaining. And my goal is really to help people understand their sexuality. Why are you driven to this in the first place? What is it doing for you? What is that relationship like? And to understand it openly without judgment. I think our fear around it and not being able to ask the questions, especially people in positions of authority, that could be really helpful in providing a safe space for especially young people. There's a lot of young people who are dealing with compulsive porn use. So I think that that obviously creates a lot more damage and a lot more wounding for people, feeling judged and shameful, and that they have to keep this even more underground, and that can impact the rest of their life. So I think education is important. I mean, I've actually trained in my clinical sexology work religious leaders that have come in and say, hey, I'm admitting I'm not comfortable talking about these topics, that I get a lot of these questions and I have no idea how to address them. And I love working with those individuals because that they're admitting that, I have to do my work first before I'm able to support someone without my own judgment or projection of my own fears or insecurities or even the unknowns that come along with that. So that's incredibly important for anyone working with sex.
No, that's great to hear. That was actually going to be one of my questions. If you do provide um help and like educate like religious leaders, I'm glad you answered that, and I'm glad that you actually are doing that. So that's really good to hear. And I want to touch on love addiction because I know your research was on love addiction. Would that also fall under the compulsive? I mean, it's not sexual, would it be, or what is it, compulsive behavior? How is love addiction different to compulsive sexual behavior, if there is any difference?
Yes, yes. It kind of has an umbrella of any behaviors or unhealthy dependencies towards love, romance, or sex. So some people can kind of identify as, I have compulsivities around sex and love, or maybe even confuse the two. Love and sex feel like the same thing. It's sort of this drive for this intensity over intimacy. I got fascinated in love addiction because love to me is really a big purpose of why we're all here and what we are driven to seek, and what it's our first emotion in life. It's what sometimes we can't survive without. That's what I found in a lot of my research. Love does impact. Lack of love, neglect, abandonment affects our overall health and well-being, our nervous system. We've shown that even babies can die without that love and nurturing connection and attachment early in life. So to me, I was looking at it. Can it become out of control, and why? What I see differently with love addiction than sex addiction, it's not necessarily this compulsivity around just the behavior that then creates a coping mechanism underneath. It has a lot more intertwinings with attachment behavior, how we get our needs met, codependency, and also what we're driven towards through fantasy. I think love is something that we hear about our entire life in a very romantic fantasy way, right? That it's about falling in love or finding love or being loved, that people are seeking that sense of fulfillment from love. And many people with love addiction are feeling a void that happened early on in life where they didn't get needs met. So they're using those relationships and dynamics to feel whole. And without them, difficulty being alone, standing on their own, having a sense of identity outside of their relationship. So I became fascinated with the topic. And also, a lot of women were labeled love addicts. And I thought that was a misnomer in the field. You know, men are sex addicts, women are love addicts. And so I really wanted to piece that apart in my research. And I find that a lot of males, females, regardless of gender, there's a lot of crossover between both of those compulsivities because the underlying root of the early traumas are very similar for those individuals.
And do you find people willing to reach out if they themselves consider themselves to be a love addict or they've been labeled that? So I'm just thinking, like, when it actually depends who I speak to, because when I hear people talk about sex addicts, some men can either take it as an excuse for bad behavior, or a sense of pride that, yeah, like they don't see it as a bad thing, or they're labeled as sex addict by maybe like their partner, what have you, if they're being caught cheating or watching porn. Whereas I'm wondering, is there much stigma or what's the association with being called a love addict for, especially maybe for women or even for men? Does it have the same like stigma, or how do people, if they've been labeled a love addict, do they feel like, okay, I have an issue or this is unhealthy, I need to seek help?
Sometimes I feel like it can be an excuse for bad behavior, as you said. I think with love addiction, people may come in and they don't identify as much with the term, but what the behavior actually is, the entail that entails, right? The behaviors or patterns that show up, the unhealthy traits they're starting to see in their relationship patterns. And I think the most important thing, whether it's sex or love addiction, is the distress. If it's causing you distress, then that's the most important part of treatment. I think for some people, for example, if a spouse is just saying you're using porn too much, you're a sex addict, and that person doesn't want to deal with the dynamic in their relationships, they're like, oh, fine, I'm a sex addict. That's, it's a clinical pathological thing, and it becomes an excuse rather than building accountability. And it doesn't lead to healthy discussions around sexuality. I think the partner labeling is sometimes embarrassed or doesn't feel safe or vulnerable enough even exploring that, or there's a lot of judgment and shaming of that behavior, which keeps that couple stuck. So I think the labels are very problematic. Honestly, you'll see I don't use them a lot, but people will come into my practice and self-identify. What I tend to use them as is let's look at these different models of sex and love addiction to help you understand and build that awareness. How is it looked at? How do other people see it? How might that be playing out in your relationship where maybe both partners have some level of compulsivity in their behavior? So it can be helpful sometimes to create understanding and educate. But I think if we are taking that label as this is it and I'm just a sex addict, which I've seen so much in treatment, that can be highly problematic for everyone involved.
Sorry, did you say that you've seen that in treatment as well? That is that by a therapist that will label someone a sex addict, or they themselves will just call themselves a sex addict and then the therapist would agree?
Both ways. Even when I was working in sex addiction treatment, there was sort of this sort of a let's apply the addiction model to sex addiction, and people were just moving right along, going through the motions, but not wanting to build and heal the traumas that led to that in the first place. Sort of using that as an excuse, or again, lacking that accountability and desire for change and hiding behind the label. So I think that it can sometimes do a disservice if we're not really teaching our clients what is actually going on instead of giving them this label and putting everyone in the same box of this is what it is. Every person that I've worked with that has compulsive behavior, even though there are similar traits in upbringing, have different patterns of behavior, different ways they're coping. So I don't think anyone can be put in the same category or looked at the same way. And I think we should do that with any sort of treatment. That's why I'm glad we talked about narcissism in one of our talks as well. These labels and ways in which we even look at mental health and struggles they're problematic. They're stigmatizing and they keep people stuck more than they do encourage them to heal.
Speaking of narcissism, do you mind defining what is narcissism or what is a narcissist?
Yeah, so my field, I should say, is very quick at labeling and having, different diagnoses. I mean, I could criticize the field a lot for where it's been and where it's come, especially in pathologizing sexual issues. But narcissism, I see it as a coping mechanism. When I see a narcissist or someone who may have those traits, I see someone that's experiencing a lot of pain. that has developed protective measures and behaviors and coping mechanisms to hide or conceal that pain, and that they're projecting a lot of that pain onto others. And that is their way of either controlling, or what we call narcissistic rage, or they are love bombing or creating this sort of charm and admiration from others in order to feel accepted. But there's a lot of insecurities, lots of fears, lots of uncertainties within that individual, not knowing who they are, and having very distorted beliefs, core beliefs about who they are, low self-worth, kind of hidden behind this exterior that is really for others and not for themselves, and can be very hard to sustain over time. So I also have a pet peeve of people labeling everyone a narcissist. I hear that in couples work. Is my husband a narcissist? Is my, we really need to not be so quick to label, but instead understanding. I think that process is so important. Let's understand the behavior before we, because what's the use of a label if it's not helping us change or motivating any opportunity for growth in a relationship?
Yeah, I was just going to ask, why do you think people like using these like labels that, especially their clinical labels, and they haven't been diagnosed? But why do you think they're quick to throw around um labels like narcissist and addiction and what have you?
There's such a lack of understanding, and I think sometimes it's validating, like, okay, this makes sense. This is exactly what I'm going through. And it's isolating, so people see a label or a diagnosis or a cluster of symptoms and say, yes, this is what I'm going through. It gives them a starting point of understanding and having self-understanding and awareness. Um, and I think that's important for people, especially when they're feeling like I'm the only one going through this, or what's wrong with me. There's so much shame around what they're dealing with, and that's often what's fueling the behavior in the first place. So having something concrete, it gives them, okay, there's hope. There's something that can change. I'm not the only one going through this. And it can give them a path, even if that path might not be exactly right for them. There's hope that there can be change and growth, and they can improve. Many people coming into this work who may have those behaviors are willing to do the work and make those changes. So there's often this myth that narcissists don't go into therapy. I think that is not true. I see many people, even on social media now, there's people that will say, yes, I'm a narcissist and I want to help educate people. And I've done the work, and people are looking at it more as not something that we want to stigmatize or, again, sensationalize, but to look at it as a general sense of understanding so we can work with it and help people, especially in community that might be struggling in the same way.
Thank you. So I do apologize. I forgot to mention you are also a sexual health expert and you do work on wellness. Can you explain the difference between the two? Because sometimes I think people use the terms interchangeably. Yeah, if you can define what is sexual health and what is wellness, because I did notice in your website you mentioned about your work in sexual health and wellness.
Yes, yes. I like to discuss both because they are different. Sexual health is more than our sexual functioning. It's our relationship with our bodies, our values around connection and pleasure, and also how we are taking care of those functions in our day-to-day life. So that may be how we're taking care of ourselves in terms of self-care, how we're relating to partners. Sexual health is also the more biological or physiological changes we go through around sex. Not just having sex, but hormone health, nervous system regulation, how our mood and how our mind impacts our body. Wellness is really the journey where we keep our sexual health in a priority of our day-to-day life, making sure that we're incorporating communication, being able to talk about what we desire and need to take care of our sexual health, being able to have boundaries and knowing what our limits are. It has a lot to do with our identity and our expression and how we show up in our sexuality. So they're both important. They both work hand in hand. And I think that different specialties work more with one than the other. And many clinicians now are really embracing both in their practice, which I love. Medical doctors, I'm talking to them especially. Many of them have really looked at treatment through a health lens or medical lens, but now are embracing that. Yes, there's a mind-body relationship. We have to look at things holistically in order to help people create a sense of wellness and design that for them in their life. So I tend to work with both and help people embrace both.
And with people who have been going back to what we spoke about previously about people that have been in abusive relationship or in coercively controlled, how do they rebuild trust and confidence in intimacy?
Yes, I mean, it starts with their relationship with self. Because when you've gone through trauma, the first thing that happens psychologically is you disconnect from your intuition or sense of self and trusting yourself. There's a lot of shame that comes along with that. So we're healing shame in that initial step. We are helping to create a sense of not blaming or criticizing oneself and working through that, moving through those emotions that might not have been safe to do during that time of trauma or what had happened if they're in an abusive relationship. Also, rebuilding intimacy. It's difficult to trust after the trauma of any sort, any betrayal, and learning those values, being able to look at how to speak up or stand up for oneself, how to communicate what feels right and what doesn't feel right, and have a sense of safety and care for yourself. And I also want to remind people it doesn't matter how long ago trauma happened, the body remembers as if it were yesterday. So it's not a linear process. It's important that we look at trauma as what it is. There are many levels of trauma. There are many ways it impacts us, not just psychologically or emotionally, physically, even spiritually. So it's important that you have the skills to work through it, safe space to work through it with someone who knows how to guide you.
And I understand that because you did mention the trauma work that you provide, or correct me if I'm not sure the correct term. But is that something that has to be done face to face, or can that also be done online?
You can do it online. I mean, basically, it's about creating that safe container. Most people that have had trauma have never spoken about it, or they've spoken up and not been believed. So I'm always there to sort of create a place where you can talk about it. And we're not talking about trauma right away. It's important that when you're working with someone that's trauma informed, that you build rapport and safety first. It's not about flooding and talking about all the trauma. We build that relationship and openness. It's important to have foundational skills to be able to talk about trauma. So that's why I work in a mind body approach. If we're talking about trauma and you don't have any skills to regulate those big emotions that are coming up, or there's a disconnection from what's going on in your body, that's where we store our trauma. So it's going to not be effective to just cognitively work through trauma or do it through an intellectual way. It's important that we use a holistic approach. So you can definitely do it over video, in person. What's most important is that relationship that you build.
And if, for example, someone wanted to contact you, what's the best way for a consultation? I mean, I know you've got a private practice in Beverly Hills, is that correct, in California?
I do. I work out here in California and offer therapy, but I also offer coaching worldwide. So people
Okay.
that, and I've had such great work with people all over the world that may come in for, questions or learning about their bodies. I've helped people have successful intercourse so they could have babies. I mean, there's so many success stories that I'm very proud of. So if you are anywhere in the world, happy to speak with you. I offer a consultation over the phone where we can meet and see if it's a good fit. I also want to hear about your concern and make sure that I am able to work with it. If there's someone more specialized or that would be a better fit, I'm always happy to refer. We have a great sex positive network of therapists, educators, counselors, and coaches. So we are a community, tight knit community that it's always willing to help or refer out. So yes, contact me. If I can't help, I will find someone who will.
And I'm sure I know the answer to this question, but I need to ask anyway. Do you also work or help people who are maybe like in a long-term marriage and they've lost confidence in themselves and they're trying to reconnect with their partner to like re is it reconnect or reignite the spark? Is that also something that you can help with?
Oh, yes, yes. Anyone who's in a long-term relationship, we're all going to go through that, myself included. I talk about that. Anyone in long-term relationship, we're constantly going through changes. So, yes, whether you call it reigniting a spark or, getting back to what feels important to you, reprioritizing connection. It's not just about sex, not just about pleasure. It's really about connection and relationship. And I always say sex therapy and coaching is about three things, three relationships: your relationship with yourself, your relationship with partners or others, and then your relationship to the world around us that influences us so much. So we look at all of that in the work that we do.
I never thought about that. The free. So I've heard of relationship with yourself, relationship with your partner. So do you mind expanding? What do you mean by the relationship with others? It's quite
Community,
interesting. Yeah.
just our society. I mean, we all live in such different places and worlds, and we're influenced by where we are. I think I was sharing with you earlier what's going on even in my city and how that impacts our values, who we are, our identity. These are all the things that are important to look at, even in sexuality. Sexuality is about our personhood, about how we show up in the world. And when things are going on that impact us, that make us feel, lack of safety or threatened or afraid, that can create so many things. That can trigger old shame, old wounds. So it's important that we see that relationship as impactful. I mean, it's constantly giving us messages of what's right and what's wrong and guiding us even unconsciously. So we look at that a lot in the work that we do. What are the things that you're consuming? What are you reading? How are you getting information? Who are you speaking with? Where and what is your community? So that's a very important part of our sexual wellness. Whether
Yeah.
we're finding it or we're fine-tuning it or sometimes moving away from communities that may be harmful.
Yeah, I like that. I've not heard that before, sorry, but I like that part. And then I wanted to go back to something you mentioned earlier, but I didn't want to interrupt you. When you were speaking about when you speak about compulsive behavior or addiction and what is out of control, what's unhealthy, does that differ from person to person, or is there like a metrics board that you can point to? Okay, this is an out of control behavior, therefore it's compulsive behavior or addiction, and this is unhealthy. Like, or is that on a case by case basis?
Yes, I'm glad you asked that because some people will say, well, what if it's just high libido? What if I just really enjoy sex? The biggest difference between the two is compulsive sexual behavior isn't necessarily enjoyable. It might be momentary gratification, but it's followed by a cycle of shame, guilt, feeling low self worth. So the level of distress is usually the biggest difference between the two. So someone who's has a high libido and is enjoying sex consensually, I wouldn't say that that's problematic unless it's creating concern for them, unless they're feeling as they're reflecting on that behavior that I'm not happy with this or I'm not utilizing my high drive in healthy ways. But that level of distress is the most important part and hallmark for the work that we do around compulsive behavior.
Thank you. And just final question before I ask if anyone's got a question. So I should have said anyone the attendees, if you've got a question, feel free to ask in the chat box before we wrap up. But I've just anyone who's an aspiring psychologist or aspiring sex therapist, what advice would you give such a person to get to be in a
Much
position like where you are?
training, do as much training as you can. I think that part of our sexual wellness is also being open to diversity, even if it's not something that we practice ourselves. So, being open to experiencing different types of sexuality, observing, learning. One thing that we do in our training that I think is so valuable, I'm actually going to be doing another one here soon, even though it's been years since I've done one. It's called a SAR, Sexual Attitude Reassessment Readjustment. And what we are is exposing ourselves to different areas of sexuality so we can get our buttons pushed, ask questions, learn, and also be aware of our judgments. This is such sacred work that we do when we're working with individual sexuality that we want to make sure we're guiding people in a healthy way. So if you're curious in the field, do as much training as you can. There are so many different areas to work in. Work with therapists, work with coaches, go see educators, do talks, go to expos, conferences as much as you can, and do your own personal work. I like that that's a requirement for our field because I learned probably the most in that frame of work, and then it helped me become a better educator as well. I was able to then work with people that were coming from similar backgrounds as myself, or conservative or traditional, but also wanted to work with sexuality. So I definitely recommend that. And don't stop learning. I love learning about sexuality. It's an everyday thing. So if you are in this work and training, just continue learning, asking questions, build community too. There are great communities for us therapists. There's ASECT, there's the World Association of Sexology. There are many big organizations, people all over the world, many backgrounds, and we all have a very shared purpose and drive and motivation. So that would be my recommendation for anyone out there.
No, lovely. No, I really appreciate that.
Oh, I
And
want to add one thing onto that is
yeah, sorry.
consultation. I think too, once you get licensed as a professional, we forget that consultation and supervision is incredibly important. And that means maybe going to another therapist that's licensed, checking in on a case. If you're struggling with something or you're a therapist out there, I'm also a supervisor. I'm happy to check in or help guide you on a case. I always want to add that in because some therapists feel, is embarrassed if they need consultation. It's part of our work and field, no matter what stage or how much experience you have.
Oh, so therapists will consult with other therapists. Is that right?
Yes, yes,
Okay.
consultation and supervision. So I used to actually run a group consultation group for sex therapists. We'd bring in challenging cases or share ideas or different approaches. What books are you reading? What's good to know? What's the latest, couples approach on this? So important because I think it gets us talking about the things that are even happening within our field. Like the big divide around sex addiction. There was a huge uproar around this in our field. There was a huge like divide between this side and that side, and I was kind of in the middle of, I can see both perspectives, but it created a lot of disconnect. And I think that's challenging for consumers that are coming in. Do I work with a sex addiction therapist? Should I work with a general sex therapist? It's confusing. I think it's important that we all understand one another's approaches and that we can clearly talk to our clients about that. And that's what I usually do. If someone's coming in, I'll say, here's what a sex addiction therapist does. This is their training. This is what their assessment and work is like. Here's what sex therapy is. Here's what a coach might do so that you as a consumer can be informed and see which approach may work better. I don't think one is better than the other. I think they're all different, but they can all be helpful. I've seen benefits from all.
Lovely. So I did forget to mention about your other offering, concierge therapy. Do you
Yes.
mind giving an overview in terms of what that is?
Yes, concierge therapy really started with wanting to get people out of the office. So, out of the traditional therapy office, I do retreats. They can be personalized retreats. I've done women's retreats, couples retreats. Concierge can also be in home assessments. This is my favorite work to do because I get to actually go into your home space and see how you cohabitate with your partner. Where do you make space for intimacy? What does your bedroom look like? How do you feel in that space? So I use my psychology and background to help people design spaces for better mental and sexual health and wellness. And then also, concierge can be really designing a personalized program that works for you. A lot of the times, I have busy professionals or people that can't do the traditional week by week model but need an immersive experience. So, we might do a 4 or 5 day intensive, or we might travel to a location and do a specific type of therapy in a nature environment or something outside of the office. I also do walk and talks where clients and I will go on walks or hikes or do things at the ocean where we're kind of doing releasing shame ceremonies. I mean, all sorts of things to kind of help people have different approaches to therapy. I think I want to get out of this traditional model that the only way to work with concerns is you sitting across from me from a computer or couch and we're talking about a processing. Even though that's highly effective, I want people to have options. So that is concierge.
No, lovely, lovely. No, it's been absolute pleasure. If anyone has any questions, please speak now or forever hold your silence, as they say. But it's
All
been
these
absolutely
good topics, Diddy, coercion. I mean, don't be shy. These are important things, and they impact all of us. I mean, I don't know about you, but Diddy was someone. He's been around for a long time. He's like
yes,
a music mogul, a powerful figure, and to see sort of this exposure and explosion of information and facts and cases. I mean, it's fascinating. I was glued into it. I wanted to, hear all about this case and how it was unraveling. And I think they're doing their closing statements right now. So yeah, we will
yeah.
see how the justice system plays out with this case.
Yes, speaking on the Diddy, I can it's been I was a big I'm not so much anymore, but I was a really big fan of Diddy growing up as well as many of my friends. And what was again like fascinating with when the allegations came out is one, I'm mainly speaking amongst my male friends, was complete denial
Yeah.
because we and then obviously when the lawsuit sorry when the allegations first came out with the lawsuit from Cassie, complete denial, he wouldn't do that, such and such. Then when he made the payoff the following day, it was still denial. And when the
Hmm.
video came out, it's like people had to see it to realize, oh, although yes, he may make great music and he's an entertainer and flamboyant, I just think again, a lot of people that if you're fans of someone, they can find it very difficult to believe that they can behave in such a derogatory or demeaning manner. So that's why when the video came out, then a lot of people then were starting to question actually maybe he might have done those things that Cassie alleged and then other people alleged. So for me, I was always asking even some of my friends, like, why is it you needed to see something for you to believe the woman or believe the victim? It's a thing where the initial assumption for a lot of my friends or people that I know of is that if it's a man who is powerful, who's rich,
Hmm.
there's no need for him to force himself or coerce anyone, so therefore he wouldn't do it. Not understanding that sometimes it's about power, it's not just about, or sometimes he just wants to humiliate someone. It's not just about because he can have relations with, and I don't even like the rhetoric when people say, such and such is, powerful or successful, he can get any girl a woman he wants, but that's not the case. That's something that is also in the minds of a lot of men in particular, like this idea that if you're powerful, if you're successful, if you're rich, you can get any woman you want. But then you hear so many stories of powerful, rich, high value, I don't like that word, high value men who
Hmm.
are engaging in nefarious activities where they're coercing women. So again, a type of education for a lot of men because I think a lot of men just think that women, like every woman, which again is ridiculous, will just be desirous of a man just because he's got money and fame and status. Because I think as men, that's what a lot of us aspire to achieve. So we think that because that's what we like or impressed by, then every woman is going to be impressed by that, which is again just ridiculous. So that's why for me the trial has been very educational for a lot of men because now they're seeing things unravel and realize no, there are some people even with the fame and the money, they still might be enacting, doing these type of activities. So if that can be someone who you look up to, who's got all of the
Hmm.
material possessions, now you should hopefully be able to listen or believe if a woman who is in a relationship with a man who hasn't got all of that, you shouldn't totally dismiss it. That's why for me it's been a yes. I don't know. It's a lot has come out of it, even from like I said, from educating and people that wouldn't have thought about these topics or these subjects, whether it's consent, coercive control, and what have you.
Exactly. I mean, you're bringing up sort of the stereotypes or how it's glorified in certain populations, or because this is sort of a beloved public figure. I mean, this person calls himself love, so it's the way in which you kind of get that admiration and even the control of people on the outside. That parasocial behavior. They feel like they know you. He could never do that. Never do something like that. But if you really look at the behavior, it was sort of always there, in the way in which he would speak to people in interviews and talk about his partying and in ways in which he flaunted women and even in his music. So I think that the signs were always there, but it
Yeah.
shows how what the public wants to see and doesn't want to see. I don't want to believe that this beloved mogul could be someone abusive, or it's got to be the women. They're looking for money, a money grab, or this or that. So there's a lot of problems with that. The Me Too movement and everything that has come out since then about believing victims, and then obviously there's a lot of cases of what's true and what's not, and a lot of cases maybe where the people haven't been upfront and honest, or those that have, and it all gets mixed together and not sorted through appropriately so people can understand and learn. But it's complicated, especially
Uh,
when it's so publicly put out there for everyone to see. And now we have social media where if you look at TikTok or any of these platforms, everyone on there is an expert in the Diddy
yeah.
trial, or has an opinion, or feels like they are an illegal or ethical expert in what's right and what's wrong. So there's a lot of influence to our opinion and perspective.
No, no, I agree. And that ties into what you mentioned about the relationship is one with yourself, one with your partner, but with the community outside world, which is very true. And I think that does definitely inform the way people view not only their own sexuality but others. So yeah, that's something. Sorry, someone asked a question. Is coercion is coercion considered more of a physical or psychological act? I know you touched on it earlier, but I'm wondering if it's actually a combination of both.
It can be absolutely. I would say physical is probably the least that we see often, even though that can be definitely what it escalates into. But it starts out at more subtle controlling behaviors. The psychological trauma is probably the most impactful because it can be subtle, or it can show up as love or affection or ways in which someone is taking care of you. So it can be very confusing in terms of someone's own values and understanding of the relationship power dynamics, feeling as if this is normal behavior. So I think that it can definitely show up in all of those realms, and it does. Yes.
Thank you. Actually, there was another question actually I wanted to ask. Um, in talking about like coercive control or sexual violence. Um, is it possible for a woman to show signs of arousal during an act where she's being coerced, but she doesn't want it?
Yes, and I think that's often misunderstood, especially for the one experiencing the trauma, where they might have had a physiological response. There can be a disconnect, disassociation in trauma. Even though the body may be responsive, sometimes that's a safety mechanism to not get injured or hurt. So that doesn't necessarily imply consent at all. Consent is not based on body language. It has to be clear communication. There has to be understanding. We don't want to assume anything. So I think those misunderstandings can cause a lot of harm or damage in creating beliefs around what consent is and isn't.
No, thank you. Yeah, because I need you to say that. 'Cause I'm going to snip that and put and send it across because that's where there's a lot of confusions and misunderstandings, especially in terms of understanding. Like I heard a ridiculous. Um, the person was a qualified therapist, but he called himself a therapist, where he retold a story of a woman who one of his clients who was someone from nowhere said forced himself upon this woman, and she said she just used her hand to touch him, and then he stopped, and he stopped, he started crying, and then he went away. So his argument was this is the power of feminine touch, and because of the feminine touch, it stopped him from inflicting more harm on her. And he was trying to use this as an argument of this is why women need to be feminine and just submit. And I was just like, and he's speaking within a religious context. I don't know, sorry, it just infuriated me hearing that and then listening to some of the comments. People were thinking, yeah, that's how women should behave, and it's just crazy. I just don't know what his rationale was, but um maybe that might be another discussion about understanding like sexual violence, because that's something that is not really understood properly, especially amongst my gender, the male gender, to be honest with you. And a
Yes,
lot of like myths stuff around.
I see that often, especially these hardwired beliefs, right? Because of that, or kind of victim blaming, or saying this person was responsible for that, or they should have communicated in this way, and not even understanding what abuse is. Most of the work that I do with someone who has experienced trauma is defining what trauma is. Most of the time in the room, we're actually naming that. That is sexual trauma, or that is rape, that is assault, learning that language. And they've never heard that before, or it's been so uncomfortable to talk about or name that. And even small things, if someone touched you inappropriately, or it took a picture without your consent. I mean, there's so many layers of what is sexual abuse or sexual misconduct that I think that's often surprising to many people, and they feel embarrassed about that. Well, I don't want to create a big commotion around this, or then they feel shame around it. And I think it's important that we look at that. There's a spectrum of many things. It's not just these bigger trauma issues. It's sometimes those more subtle dynamics that are the most damaging, especially when we see that a lot in workplaces with people of authority, a boss and an employee, or utilizing those power dynamics in a way to control that individual or to be coercive around sexual behavior. So such a need for education.
No, but that's why people like you are very important. Just closing thoughts. I'm going to send everyone a link to obviously your website, drshannonchavez.com. obviously your Instagram, Dr. Shannon Chavez, and again, I'll put a link. Are they the two best places? Because I think it's got your email address on there. Are they the two best places if people want to contact you?
Yes, definitely. Go to the website. There are places there where you can contact me directly. You can sign up for a consultation, read all about services, and there's so many good articles and resources there. So if you want to do a little learning or reading or finding out a bit about all of the things we talked about today, there are good resources on the website. And you can also sign up for my newsletter where I send out different guides and resources for embracing sexual self-care, intimacy skills. And this past month was Men's Health Month. So I have a lot of great tools and resources for men, all about taking care of themselves, intimacy skills, everything that we talked about today, and good statistics on men's health.
Lovely. And that's on your website. They need to sign up on your website for the newsletter. All right.
On the website, yes, you can sign up for the
Great.
newsletter and then access all the articles. All the articles are there for free, and then you can contact me there as well.
No, lovely. Thank you. Thank you, Dr. Shannon. It's been absolute pleasure once again for blessing us with your knowledge and light. Thank you for everyone for attending. I'm going to stop now and then but yeah, it's been absolute pleasure. Yeah, thank you all. Assalamu
Thanks
alaikum
for
wa
being
rahmatullah.
here. Yeah.